All right, I think we have a quorum, so I'll go ahead and get started. While everyone is coming back, I hope you had a good lunch or whatever time it is where you are. I hope you had a good meal or break. It's great to virtually meet you all. I'm Dr. Kahan. I'm one of the fellows here at CHLA in epilepsy. I trained in child neurology at UCSF, and you'll hear me talk a little bit about the transitions work that we did there as well. But basically today's talk is going to be about transitioning to adult care, making the big leap, and ways that we can support you and things to start thinking about on this big journey. And I'll leave a lot of time for questions at the end. So just remember them, and we'll save them all till the end. And feel free to type them in the chat though as we go. All right. So just to give you a little bit of background, not really conflict of interest disclosures, but just in terms of things that I've done in the transitions world. I'm a member of a joint committee between the AAP, Child Neurology Foundation, and the AAN, American Academy of Neurology. We're in a working group to work on transitions of care for teenagers with epilepsy, and I'm also on a separate AAP committee for children and youth with epilepsy. I received this year's Child Neurology Foundation Excellence in Transition of Care Award, and then parts of what I will show you is also going to be presented at the upcoming AES conference this year. So just to go over, because I think there are probably mostly parents and caregivers in the audience, so that's who my talk is targeted to today. So the what and the why of transition. What is it? Why do we care? Why do we want to start talking about it? So 40 to 50% of children with epilepsy will continue to have this diagnosis into adulthood. And as much as your pediatric neurologists and epilepsy doctors want your child to have excellent care forever, our offices only see pediatric patients for the most part. We are pediatric trained, and just the way that our healthcare system is structured, usually for most children, the transition will be inevitable to adult care at some point. And adult clinicians can also help encourage independence, especially for those adolescents with more typical development, and discuss kind of taking autonomy over their own care and more adult specific issues that I'll get into. And often in terms of who you'll transition to, most often your child will transition to an adult neurologist or an adult epilepsy specialist. But some primary care doctors as well, especially if you live in a more rural area where there isn't as much access to a neurologist or epileptologist in the adult world, your primary care doctor might be more comfortable managing epilepsy as well, if that's your main option. So when do we start talking about transition, and when does transition happen? So the timing varies by practice and, in terms of both who pediatric providers stop seeing at a certain point and who adult providers start seeing at a certain point. But with this in mind, usually our goal is between 18 and 21 years old for most patients. And if, for example, at CHLA here, we're a CCS center. So if your child does see a CCS neurologist or epilepsy specialist, usually we will see them until age 21 if you have CCS. But most guidelines, 18 to 21 is pretty old in the world of pediatrics. So most of our national guidelines recommend talking about transitions early. So even as early as age 12. But this is just to make sure you're more prepared for when the time comes. So don't be scared, keep calm. We like to bring transitions up early. So if your neurologist or epilepsy specialist brings up, what's your plan for transition, or let's start talking about it, let's start making a plan for it. Don't be alarmed. This is not something that's going to happen tomorrow or this year necessarily if they bring it up before age 18. It's just something that we like to start talking about early to make sure everyone involved is prepared. So in terms of topics to discuss and plans to make when talking about transition, these are some of the things we like to think about. We like to make sure that before transition, you have a good medication plan and strategies for adherence to that plan, especially if you're a more typically developing teenager who's going to be responsible for taking your own medications. We want to make sure you have a plan to know how to remember to take your medications, whether it's an alarm on your phone, a pill box, a combination of things, doing it when you brush your teeth, all kinds of different strategies that we talk about to give patients autonomy to manage their own medications. And this also includes things like knowing when to call the pharmacy for a refill. Who do I call for a refill? How do I get in touch with my doctor? From a diagnostic standpoint, we want to make sure before transitioning to an adult neurologist or adult provider that all of the diagnostic workup we want to do is pursued fully if it's needed. So this may vary by the type of epilepsy your child has, but it can include things like genetic testing. And for children with focal epilepsy coming from one part of the brain, sometimes we will do a pre-surgical evaluation as well. And some of these things, especially genetics and the pre-surgical workup, we've seen are harder to do in the adult setting just for logistical reasons and just in terms of the services and the infrastructure that's available. So it's important to make sure you see your neurologist regularly before the transition happens to make sure they've done all of the workup that they need before it's time to hand you over. Having a plan for insurance. This used to be more of an issue than it is now, thanks to the ACA. Most children can stay on their parents' plan until age 26, so this is not as big of an issue as it was before. But with things like CCS too, it is something to talk about, and your social workers can help with that as well. Making sure your seizure action plan is up to date and is something that works for you. If your seizure action plan is up to date, but it doesn't work when you give your rescue med, it's something that you want to discuss before you go out into the adult world. And especially for those who are going to college and being more independent, having jobs, doing things where they're taking public transportation, it's important for teens to know what to tell other people to do in an emergency. Do they have a letter in their bag or a note on their phone saying, this is what to do if I have a seizure. This is how you should take care of me if I have a seizure in public. And knowing how to advocate. So as I mentioned, it's really important for teens who have typical development to be able to get their appointments that they need, to get the care that they need, because there's a little bit less hand-holding in the adult world. And it's actually a good thing, in my opinion, because it leads you to take more control over your own health. So in terms of more adult-specific topics that we'll discuss during the transitions process and that we'll encourage parents to discuss with their teens during the transitions process. So like I alluded to, what having epilepsy means, just from a social standpoint, as you get older, can I go to college? Can I work? Can I be independent? And what it means in terms of the social stigma, which unfortunately is still there in our society, and kind of strategies to respond. And if people are bullying you or people are commenting, how to address talking about your seizures with others. And driving, this is a whole talk in and of itself, and it varies by state if some of you are joining us from different states. So California has its own set of driving laws, but every state is different. So this is a really important conversation to have with your epilepsy provider before you transition and before you get to driving age. And then all the adult behaviors, the things that people are scared to talk about, but are very relevant for epilepsy. Sexual health, pregnancy and epilepsy, and this is, as I'll get into, not just for typically developing teens, and then substances and alcohol, as these are things we know can provoke seizures. So it's really important before our teens go off into the world and go off to college or go off, other places, that they know things to avoid that can trigger their seizures. And then suit up. This is also a whole separate talk in and of itself. But if you have not talked about suit up with your provider, the transition process is a great time to do it. And it's an important thing to discuss, especially if you're, sleeping alone for the first time in your life. So specifically for patients who have neurodevelopmental differences, topics that are important to discuss before the transition are conservatorship or guardianship. And we'll talk, if this is something that might be needed for your child or might be helpful for your child, if they need help in making their own medical decisions. And I think our social workers are a great resource for this. If your hospital system or your office has a social worker built into their practice, this is a great reason to talk to them and specifically talk about the logistics, medical legally of this, since pursuing this is a legal process that you have to, talk to the courts about. For young women, even with neurodevelopmental differences, it's important that teenagers or young women, as they get older, take folate to prevent birth defects if they're on anti-seizure medications that can cause birth defects if you do get pregnant. and then empowerment and discussion of consent. Even people, young women who are, not typically developing, it's important for them to have a discussion or at whatever level that you can. And there are also some great programs in the community to, teach about what is consent and, protecting your body, because sometimes, things like, anti-seizure medications can affect the development of a fetus if they do get pregnant. And employment or day programs. So where are you going to work, or where are you going to spend time during the day? And then where are you going to live? Are you going to be in a group home? Are you going to be independent? Are you going to live with your family? And what do those things look like? These are all things to start thinking about so that, your child, your young adult is not left high and dry when it's time to figure all of this out. And then other things that can come along with epilepsy, kind of in the longer term setting, as most of you probably know already. Mood disturbances like anxiety and depression have a much higher prevalence in patients with epilepsy than in the general population. So it's important to talk about these things. Sleep issues, nutrition, including vitamin D, checking that, making sure it doesn't need supplementation. Learning difficulties and ADHD, and that goes along with support for school. If you have an IEP or a 504, how do we transition that? If you're going to an adult day program or if you're going to college. Exercise and bone health are also things to discuss. Bone health, especially as you get more toward becoming an adult and you're on certain anti-epileptic medications for a long time, it's something that we screen for. And then questions that caregivers should start thinking about to make the transition process early or easier. So what adult provider will my child transition to? So if you're at CHLA, usually we'll recommend going to a USC affiliated adult neurologist or an epilepsy specialist, but we have many great places in our community and many great hospitals in our community. There are, if you are seen in another academic hospital system, for example, where I trained at UCSF, we were also connected with an adult neurology program. So that makes the transition a little bit easier when your current hospital has an adult program. The handoff I've found is a little bit more streamlined, but there are also several excellent neurologists in the community and primary doctors. So if it makes more sense for you to have someone closer to home and they're comfortable caring for you, those can also be great options. And then also things to think about, what are your own priorities in transitioning and finding a doctor, both, your child and your own priorities. What do you want your doctor to know? What qualities do you want your doctor to have? The when, so this is something you can always ask if you're not sure. At your next visit, you can always ask your epilepsy specialist about transition. And then, like I alluded to, what do I want my new provider to know or understand about my child? So in terms of resources that can help, there are several. One that I like online, which you can easily Google, is the Epilepsy Foundation website. They have a whole transition page, and it goes through, a lot of what we're talking about in this hour in terms of, the basics on transition and kind of the more nuanced things too. You can see they have information about managing your medications, driving, being independent, female issues, things like that. This is a questionnaire. Some hospital facilities will have transition readiness questionnaires. And this is an example from Canada, from BC Children's Hospital. It's called the Am I on Track questionnaire. And these are it's a good guideline in terms of assessing independence and assessing, what areas you might need more help with as you're getting ready to become an adult. And as we talked about, things like knowing your medications, knowing how to get your medical records, knowing how to get to clinic, knowing about sexual health, and all of these are really helpful to assess before transition to see what we might need to, provide more support with. And then things that I've been involved in to improve transition on the national level. So this AAP, Child Neurology Foundation, AAN collaboration, we have worked on this toolkit that is targeted toward adult neurologists and adult providers to help streamline the transition process. So that's going to be hopefully rolling out likely in the next couple of months or early 2022. So that will be kind of on our back end, helping for our adult colleagues to feel more comfortable with the process. And there are already several excellent guidelines that already exist. So there are, this is from the American Epilepsy Society. You can look at the AES website. This is an example for a typically developing adolescent, but there are also examples of kind of a timeline for children or adolescents with developmental disabilities, and that's a little bit different. But as you can see, it goes through specifically targeted to providers, but it's helpful to look at if you're a parent too, kind of things to talk about at each visit regarding transition, depending on how old you are. And then at UCSF, something that I worked on was a transitions packet or transitions toolkit that was embedded in our electronic medical record. And a lot of systems will have things like this. That's really helpful. Ooh, my battery is running low. I'm gonna pause for just a minute and plug in the computer. Thanks for your patience. All right. Hopefully my computer won't die on us, and apologies if it does. All right, so this is our electronic medical record toolkit from UCSF, and if your provider does have one, it can be helpful so that you can have a nice little packet that gets updated at every single visit. And then by the time you're ready for transition, that packet can just go to your new adult neurologist and be a really nice summary of things that have been done in your workup and things that are left to do and kind of your priorities for transition. And you know, even if it's not a dedicated little summary like this, most pediatric neurologists or epilepsy doctors will, you know, type up some kind of a summary, or their last note will have some kind of a summary that's thorough to give the next neurologist as a handoff. So at UCSF, I worked on a survey of caregivers, specifically of teenagers with very complex forms of epilepsy. So that includes Lennox-Gastaut syndrome, patients with a device in place, like a VNS or an RNS, post-surgical patients, patients with Dravet syndrome, keto diet, and then other genetic mutations that are associated with difficult to control epilepsy. So this was kind of the breakdown of our population. We ended up surveying a little over 100 caregivers, 116. This is kind of the breakdown of who had what. And we gave a 9-question survey all about transition readiness and how confident caregivers felt in different parts of the transition process. And you can see kind of what it looks like here. And they were mostly on a 0 to 100 sliding scale. So we found that, you know, in this population, unsurprisingly, since their epilepsy was more difficult to control, about 83% of parents thought that their child would need more decision-making support. Children with more difficult to control epilepsy often end up being children who have various degrees of intellectual disability, or children who have, you know, different developmental differences. So, you know, unsurprisingly, in this population that had more difficult to control epilepsy, more of them would need help, whether it was conservatorship or other decision-making support. In our population, caregivers felt pretty neutral and felt, you know, about average that a new neurologist would understand their diagnosis in adulthood. And similarly, they felt pretty average that, you know, they had a plan for their epilepsy care after age 18. So clearly things to improve upon. And then post-surgical patients actually did a little bit better. Families of patients who were post-surgical scored on average almost 20 points higher for confidence in a new provider understanding their diagnosis, and 13 points higher for a plan for insurance. So this may have been because at least at UCSF in our post-surgical population, epilepsy tended to be better controlled. And, you know, often, you know, just nationally, that is something that we hope to see after surgery, is better seizure control. So that might be why people were more confident in that. But overall, you know, this just shows that transition is a scary time, and it's a thing that, you know, caregivers still, you know, need a lot of support with and want a lot of support with. So this is to say we're here for you. And we also found that specifically caregivers of children with Lennox-Gastaut syndrome and caregivers who don't speak English were less confident in managing a seizure emergency, which you can see here. So just to sum up, and then we'll have a lot of time for questions. So things to do to prepare for transition: start the discussion early. I can't overemphasize this. You know, even if it seems like it's too early, you know, 12 and up is a perfectly appropriate and a great time to start talking about the transition. Look into options for adult neurologists in your community. So you can ask your current neurologist what their usual plan is, ask for recommendations, and you'll also want to set up a new adult primary care physician as well. And make sure your seizure action plan and medications are updated, and start involving your teen or young adult and encouraging them to take charge of their care if that's appropriate for their developmental level. And then look into guardianship or conservatorship if it's relevant for your child, and think about both your priorities and your child's priorities and concerns, since that's really most important. And we're here to help. So this should not be a scary process. We want you to succeed. You know, when you go out into the world, we want your child to succeed. We want their epilepsy to be well treated, and we have confidence in our adult colleagues that it will be. And you know, by talking about this even earlier, we can ensure a successful transition. So I left a lot of time for questions. So feel free to type them in the chat, or you can just raise your hand or speak up. Oh, I think we lost some folks because, oh, maybe not. All right. Going once, going twice. And I'm happy to share these slides as well. Patients and parents should be made aware that adult neurologists will want to repeat tests and EEGs. Yes, that's a great point. You know, as adult neurologists are getting to know your child, often they will want a repeat study of some kind, depending on what's available. So ideally, your new adult neurologist will get a transfer packet from your pediatric neurologist that includes all of their diagnostics. But every neurologist is different. So in some cases, if they feel, you know, for their own style of practicing neurology or epilepsy, that more information might be helpful, then in some cases, yes, they will repeat things like an EEG or brain imaging. And then Christine says, it's a very scary process. We don't have any referrals to adult neurologists because we use THC for primary control, plus have MIDO disease. Any recommendations? Yeah, that's tricky. Oh, THCA. Okay. Yeah, so in terms of MIDO disease, I know that genetics and metabolic genetics is typically a specialty that does follow their patients into early adulthood, or sometimes even later into adulthood. So with MIDO itself, often the genetics, so the genetics folks will, you know, be a support system throughout the life, which is great. So you won't lose that continuity. And in terms of comfort of adult neurologists, you know, using things like THCA for control, I think it's provider dependent. And, you know, I apologize, I'm new to the area. As I said, I, you know, came from San Francisco. I just started fellowship here in July. So I'm still learning in terms of the individual adult neurologist in the LA area who's comfortable managing what. So often it is a little bit of trial and error in terms of finding someone. But I would definitely make sure that you have a great adult primary care provider, and then, you know, speaking with your genetics specialist as well. Yeah. You know, it's not a perfect process. It's not a perfect process by any means. You know, transitions is still a super hot topic in the epilepsy world. As providers, we are still actively working on ways that we can make this process better. And as I showed you, there's a number of other interventions on the national level that we're doing to make our adult colleagues feel more comfortable with all types of seizure management. So don't be scared, you will find someone. Is there a way to look, aside from, looking at various hospital systems, like contacting neurology departments in the area? There's not like a registry. It would just be, talking to your current pediatric doctors for recommendations, and then, contacting like USC neurology, UCLA neurology, various clinics in the area. There's not like a registry or anything like that, because there's just so few of us, both, so few epilepsy specialists. And oh yeah, Epilepsy Foundation is a great resource too. I don't know that it's like fully comprehensive, but Epilepsy Foundation is a great resource. I showed them for their transitions resources, and they're just an excellent resource in general. So I would definitely recommend that. Thanks, Angelica. Great questions. Other thoughts, questions, comments? Well, I might end a little bit early then. And here are all of the resources that I used. And these slides can be available if you want to reach out to the coordinators. I'm happy to share these slides, and I'm happy to be in touch if anyone has any other more targeted transitions questions. Thank you so much for listening, and thanks so much for your time. And enjoy a little bit of a 20-minute break before Julia comes back.